Healthcare Sierra Leone, USA. On behalf of Healthcare Sierra Leone, in collaboration with the Minister of Health and Sanitation, represented by Madam Miriam So, we came here because I have been told by Dr. Sama, who is a member of Healthcare Sierra Leone, the need for this clinic and the need for the children. So we came with this donation, we came with this gift to donate to both government hospitals. So this is Dr. Nari, and she's the one responsible in charge of this place. And this is the matron that I have met, and she's the deputy matron as well. And we are host.
Promoting the vision of the President, Dr. Julius Maada Bio, in providing excellent healthcare, customer care, and active participation in medical, nursing, midwifery, and allied health education. Healthcare Sierra Leone, a diaspora organization based in Sierra Leone and the United States of America, has donated heart and blankets for newborn babies in Bo and Kenema government hospitals. According to the chairman for Healthcare Sierra Leone, Dr. Michael Rogers, the organization is committed to donating more materials for neonatal babies and that they are contributing to help save the lives of Sierra Leonean babies in the country.
So we came here because I have been told by Dr. Sama, who is a member of Healthcare Sierra Leone, the need for this clinic and the need for the children. So we came with this donation, we came with this gift to donate to both government hospitals. So this is Dr. Nari, and she's the one responsible in charge of this place. And this is the matron that I have.
Giving background of the organization, the chairman disclosed that the organization was established with the aim of collaborating with the Ministry of Health and Sanitation to improve on healthcare delivery, including reduction of the high infant mortality rate in the country.
Well, on behalf of Healthcare Sierra Leone, USA, we donated baby items to government, Kenema government hospital, neonatology department. And we did this in collaboration with the Ministry of Health and Sanitation. So these are items we brought from the US, includes hearts of kit for infants, and Dr. Sano laid emphasis on family. That's one of our focus areas.
Dr. Rogers pointed out that the need for the donations cannot be overemphasized, adding that premature babies are mostly challenged in getting this kind of materials.
Yeah, we look at it small, but it's really very important and critical. Yeah, within the first few hours after delivery, that you keep these children warm. So this is what really they need.
He revealed that the need for the Minister of Health and Sanitation, Dr. Ostehinga Dembe, to appoint someone that will be working directly with the diaspora was timely, and it will continue to yield dividend. He continued that the vocal person has been helpful in making some diasporas to come back to invest in the health sector, and confirmed that the vocal person is emphasizing the need to harmonize the diaspora mission with the Ministry of Health and Sanitation priority areas. Maria Mansour, Special Advisor to the Minister of Health and Sanitation on Gender Mainstreaming and Diaspora Engagement, revealed that when the Health Minister was appointed last year, among his many priorities was to tap into the Sierra Leone diaspora.
The Minister was appointed last year. The first thing he realized was the Sierra Leone diaspora, who are all over the world, are a very important resource for our country. So he went out of his way to make sure that they establish an office of diaspora engagement so that we can harness all of their collective potential and bring them back home to work with the Ministry of Health. So this is just one example. As you just heard from Dr. Rogers, he is the chairman of a group of Sierra Leone professionals, health professionals in the United States, which consists of different specialties, right? And they come here as volunteers to their own country of origin to help the Ministry of Health, realize the health delivery for all Sierra Leoneans. This idea was from one of his members who's Dr. Samuel. He's a world-renowned neonatologist. He's been here several times. He's an expert on these small babies that we just saw. And like you just heard, with everything else they need, more importantly, they need to be warm. Since we don't have the resources to have incubators for all of these babies, keeping them warm is very, very important to keep them alive. So non-Sierra Leoneans heard this story all the way in Florida and decided that they will contribute in helping us save these babies, right? So they brought a group of women, total strangers, American women. Some have never ever been to Africa, or let's say most of them have never been to Africa. They decided they want to save our babies. And they sat down and knitted these hearts and donated blankets and all. And like you just heard from from Dr. Rogers, he just brought samples because he was flying. You know, you can bring us so much on flight. So they'll be shipping a lot of these items for our babies.
Receiving the items, the pediatrician at the Bo Government Hospital, Dr. John Nally, thanked Healthcare Sierra Leone USA for the donations, noting that the materials donated came at the right time considering the challenges faced by the Special Babies Care Unit.
This is important for small babies because they need to be warm. So I'm sure it's going to be helpful since they're entering the rain. So babies that need it, especially the small babies will benefit from it. So I'm very grateful and thankful for this kind gesture. These are things that will keep the babies warm. So if you do something to babies like this, especially as newborns, to help them to keep that temperature so that they don't have problems that with hypothermia, as we call it in the medical term.
Also receiving the items from the government hospital in Kenema, the pediatrician in charge, Dr. Kazewako, emphasized the importance of the items and assured that they will be used for the right purpose.
This is a referral center for Kenema district. In addition to Kenema district, we also receive babies from Kalan areas that are not closer to this place. So these are some of the few challenges we encounter while we care for our babies. We welcome donation from any partners that will help us continue to care for our babies, so that we ensure that babies continue to live.
Some of the doctors and matrons in these two hospitals had this to say.
Yes, what if I wrap the picking, they get and for make the wrap the picking, for making the picking survive. And that kind of concern for one another now in our community. So I say, Lord, we come on board and left the criticism. And then we pick up how to remove the problem as of the next. It can be new picking, it can be young picking, where bomb then can premature picking. So Lord, all solve the problems together, we will succeed.
We start by thanking you for the support you are giving to us. We have been receiving support throughout the year from donors. It is actually an honor to recognize individuals, organizations, support group like yours that comes to our aid in terms of dialogue.
Yes. So for you to consider Sierra Leone, say this is your home, and what you have gathered in US, say you are going to share with us to save lives. I really appreciate you. I appreciate your effort, and God bless you.
Reporting for Beyond Borders Online Network Television, I am Mohammed Amara Gando.